Thank you very much. Habari zenu? Zuri. It's a youth conference here, so maybe I should be saying Mambo Vipi. Poa poa. All right. Well, great. It's great to be here. It's in some ways feels like coming back home. I used to live in Nairobi. I was here 2009 to 2014. Although I work in a commercial setting now, at the time I was with Population Council. I was a health systems researcher. And so coming back today, connecting, it's great to see the overlap between the future, digital, and this persistent, consistent focus on evidence, on research, and what we can learn going forward. When I first moved to Nairobi in 2009, I learned the month I arrived, in August, was the same month that sea cables connected Kenya to the world. Prior to that point, all internet went through satellite connections. And so it was high latency, high cost, limited bandwidth. When fiber optic came and landed in Mombasa, the world changed. Suddenly the world was closer, it was lower cost. And I started noticing very quickly in Nairobi and more broadly across the country and the region, driving innovation, driving down cost, the use of digital in commerce, in ag, and education, and in health. And I got bit by the bug. I wanted to try my own mHealth innovation. And there was a lot of money at the time and grants to set up concepts around mHealth. I got into it and I got my own mHealth grant, created a digital solution for helping women self-screen. Using guidelines from the Ministry of Health, we came up with a tool to help women self-identify high-risk pregnancies. It was pretty good. We're actually better at defining or identifying problematic mental health concerns that weren't always coming out in clinical consultation with the nurse. At the end of the 2-year grant cycle, though, that was it. That was the end of the model. And we had to shelve that innovation, write the report, and kind of walk away. And that, for me, was a big eye-opener. How do we drive sustainable innovation at scale using digital? So with that, I want to jump into today's talk to give you a sense about how far we've come since 2009, where behavior change is at with digital, and what the future holds. I'm going to hope that I can get through the slides. Great. So with that, I'm going to present 3 frameworks that can help anchor our understanding of digital, some digital solutions, and some barriers that have emerged from the literature, how digital can help resolve or overcome some of those barriers, and what it means to deliver behavior change, and a few reflections at the end. So I want to first start with behavior change, where a lot of us work, serving individuals through digital channels. The intent is to help individuals become more switched on, to help them become more aware or consider, contemplate steps that might address their emergent health priorities. This stages of change or trans-theoretical model is a useful mental rubric or means to kind of checklist. Are we addressing all the potential ways or solutions out there to help individuals progress on their priorities and health goals? I'm drawing from experience now with Nivi as one example, but there are others out there. Many of you here are using similar solutions to drive this stage-based and goals-oriented behavior change, where individuals move from a state of pre-awareness into now preparing or deepening the resolve to act and preparing to act, to taking action, and then remaining adherent to that action. Of course, this is not a simple linear process, but one that's dynamic, in which individuals may achieve that goal, may take up contraception, but may not remain, let's say, continue to contracept, may fall back. And there's this sort of cycle or series of cycles that we can expect to see with individuals on that pathway. There are a number of techniques that we deploy in our digital ecosystem that many of you may be using as well. We think about games, and we think about quizzes. We think about means to reify goals and speak to where the individuals are at. So all of those fit within this theory-based approach. And we use the theory to inform our operations. Of course, there's a larger ecosystem in which we are deploying this tech solution, in which many of you are operating as well. You're deploying it into an ecosystem, in some ways, if you want to think of it as a marketplace in which there are demand-side factors, and there are supply-side factors that are helping, I wouldn't say drive, but maybe support, encourage, coach, and accompany individuals to potentially services, points of care, where they can find products and services at maybe an online store or a pharmacy, or maybe a clinic or a hospital. And for adolescents and young people, that behavior change intervention that you're deploying on the demand side is intended to cascade, for many of them, to service uptake or product uptake. Now, that approach, that ability to drive behavior change, is done by serving specific segments. And I want that idea of segmentation to be a key takeaway from today's keynote. Understanding reaching individuals at scale often means being very focused on specific segments with different messages and different motivations, helping them all end up at some point in seeking care at one of those points of care. And then considering as well maybe the unseen aspect of the supply side, what it means to do digital innovation with providers, better training, either pre-service or in-service training, to improve their receptivity in serving the needs of young people and adolescents. There may be digital innovations in advocacy to take policyholders, messages to policyholders about the need for regulatory reform and shaping the marketplace so that it's better meeting the needs of young people and adolescents. So this framework here is just a useful mnemonic device or ways to remember where can I be applying pressure effectively, efficiently, and at scale with my digital innovation. Is it operating on the demand side? Is it more supply side? Ultimately, what we're trying to do with these interventions is move the needle on some aspect of universalism, being universalist, being more equitable, and trying to reach more people, cover greater segments of the population. Many of you are thinking about reach and coverage, but covering individuals with what? At the end of the day, you want to improve or be able to provide better access to high-quality service packages, thinking about digital as a way to augment, to reinforce high quality. Maybe it's soliciting feedback from users about the service they receive. Maybe it's digital counseling before they go see the provider, so they're better informed and know what to ask for when they arrive at the clinic. And also thinking about the use of digital to remove that out-of-pocket cost or address barriers to care that might be financial in nature. These three pillars of UHC, ultimately are ways in which we can help, again, organize and situate our interventions in the larger picture. So real quickly here, I wanted to dive into the literature, and I found a systematic review 2022 that was looking at the effectiveness and characteristic of various mHealth interventions that are increasing adolescents' use of sexual and reproductive health services in the sub-Saharan region. So this systematic review drew upon 10 studies. It went through an exhaustive literature search. And what I began pulling from this paper were several key, I think, interesting insights about the nature of these mHealth interventions that were targeting adolescents and young people. There were certain patterns that began to emerge. In the literature, there's a well-established cluster or series of behavioral change techniques, these BCTs. And these behavioral change techniques, again, thinking back to that trans-theoretical model I just presented in the earlier slide, these BCT or these behavior change techniques can be deployed in the context of messaging bots or web apps or other channels, and they're meant to provide some stickiness, some means to help individuals realize where they're at and where they want to go and how to get there. So there are feedback and monitoring mechanisms. Those were very common. 6 of the 10 studies were using these techniques. Social support. 5 of the studies were deploying different techniques to encourage support seeking from peers, from family, or from other members of the community, whether that community is identity-based, LGBTQI, or community in the sense of geography or proximity, or maybe a community like a school. 4 studies were looking at shaping knowledge. Not surprisingly, a lot of interventions in this systematic review and elsewhere focused on pushing out information. And others were looking to link and associate positive behaviors with positive health outcomes. One study was looking at rewards and threats, so that fear-based messaging that we heard earlier from our colleague in Zimbabwe about the early years of the HIV epidemic, that fear-based messaging was consistent in some of the SRH interventions as well, which might motivate people on the short term, but we've seen in other contexts are not always long-term effective. But there are many more behavior change techniques than what these studies encountered, and there were actually another 10 unused techniques that were uncovered in this systematic review saying there was an absence of their use. There were other issues around identity, around scheduling consequences, around this goals and planning. Many of you are doing goals and planning. In this systematic review, they identified that gap. So these techniques, I want to highlight them because it's a useful, again, checklist. Am I covering in my intervention, your interventions that you're deploying, are you covering the range of options available? And once you've tested one of these techniques, does it work for you? Does it work in your context? And if not, maybe try one of the others. So this becomes a useful means to work through a solution for what works with you. Now, out of this paper as well, I quickly asked Perplexity, one of the AIs online, to do a quick content analysis and identify where the barriers existed for adolescent and young people and how digital channels were being used to address or overcome those barriers. Real quickly, the first two, lack of awareness and limited health literacy, really individual focused, demand-side focused barriers were being addressed through SMS and interactive online tools. Barriers more around accessing service, whether it's timing, location, or cost of service, or concerns that the provider is not going to respect my privacy or is going to have a negative attitude when I come in as a young person. Studies were looking at those barriers and how digital can both help the individual overcome or address those, and also operate on the supply side to improve provider awareness and receptivity and warmth with youth. Lastly, two interventions were looking at social norms and policies and how digital can be used as an advocacy platform. Facebook to organize, or other digital tools to organize for policy reform, for instance. All right, real quick, in today's session, in Fast Forward, I also used our AI online to do a quick content analysis of several abstracts that you'll hear today in the session. And I asked it to identify themes relevant for today's session, and it found in the abstracts that there were certain patterns, again, in the data, that the abstracts were speaking to, in some cases, a user-centric design either for adolescents and or by adolescents. 3 of the abstracts out of the 7 were addressing that. Integration with existing health services. Not all of you were looking at integration to health services, but for those of you doing that, you're using digital to augment that. There were 3 studies, there were 3 abstracts addressing that. There were 4 abstracts addressing digital equity, and a large focus on prevention and health promotion for the various segments that you're serving. Interestingly, and kind of personally based on my story with my own mHealth experience back in 2011 here in Kenya, financial sustainability and scalability was only being addressed by 2 of the abstracts, and I think it's something that really as we go forward here, I'd love to talk with more of you about your business solution. How are you approaching financial sustainability with the interventions you're deploying? So just a few reflections on the abstracts you're hearing today and some of the themes you're going to hear come up, how they overlay with those frameworks that I first presented, keeping those in mind. Behavior change, marketplaces, and ultimately population coverage. So I'll sum up real quick, last slide. Reflections on what I've seen in the abstracts to date. There's a lot of focus now on addressing those immediate needs, those emergent needs, those urgent needs that end users have, and essentially addressing or responding to opportunities that are funded. And so we're looking at this sort of dialogue between development partners with the grants and development implementers that are receiving the grants, and there's a response, a dialogue, a conversations happening there, and it's really a lot of innovation focused on where the money's at. With that, there's a strong focus on prevention, health promotion, again, which you would expect with adolescents and young people, largely healthy, but having this desire to maintain that wellness. There's less of a focus on sustained behavior change. It's a lot about taking up service, initiating contraception, for instance, or taking that HIV screening test, and less about how do I sustain that behavior and avoid that significant loss to follow-up. And there's also this idea of segmentation, not only on demographics, not only age. We're not only talking about, again, adolescents as a monolithic group, but psychographic segmentation, thinking about those who are highly motivated, those who are hesitant. How do we address hesitancy? What do we do when someone's highly motivated? How can digital appropriately address those range of needs in this same demographic group? Love to talk with you more about that throughout the conference. So a few questions for the researchers, advocates, and social entrepreneurs amongst us today. What business strategies are you working on that are going to complement and ultimately support scaled solutions for adolescent SRH and HIV priorities? One question that came to mind for me, where does menstrual health fit into this conversation on digital and AYP? Menstrual health as an area certainly adjacent to, and I think a useful entry point for many adolescent young people. It can be a useful entry point for discussions around SRH and around HIV. How are we designing for that? And really important, now 2024, fast forward from when the sea cables landed in 2009 to today, generative AI is going to change our future. How are we going to change with it? How are you incorporating Gen AI into your work? So really looking forward to the conversations, and thank you for having me.